Hi, good afternoon. So let's do topic number one. What are the benefits and challenges of utilizing multidisciplinary teams in community mental health care? So we are very familiar with this because that's what we do in our organization, Kaiser Permanente. But since we are asked to discuss the benefits and the challenges, I'll go first with the benefits. So it's holistic, person-centered care, and all the expertise that's needed for to take care of the patient is there. So the ingredients to make the patient whole again and the treatment effective is there. And then the other one is improved care coordination. So you don't have to uh, the emphasis or the product is the interactions between the activated individuals in the multidisciplinary team. Shared decision making. So there's the input of everyone involved in the care. Another one is diverse expertise that leads to better outcome. Just like what I said in number one, all the expert skills that is needed to heal the patient is there, and trauma-informed care. So teams trained in trauma-informed care are better positioned to recognize the impact of trauma on mental health. So that's the multidisciplinary uh, team benefit. Do you want to discuss the barriers or the challenges? Okay, Christina.
So in my position, in my department, it's California Children's Services, and we deal with Medi-Cal patients under 21 with certain diagnoses where the state kind of helps in and pay for services pertaining to that diagnosis. And so a lot of requirements for these patients are special care centers, which are multidisciplinary teams, whether at Kaiser or at CHLA or CHOP. Um, and while these are great, oftentimes when the patient needs particular care, the parents don't know sometimes how these teams work, right? And so I think the barriers would be a little bit more, education for the parents. Because simply, when your child is sick, especially with these diagnoses, they're not very nice diagnoses that I see. Parent is probably all over the place. I'm a parent, we're all parents. Um, and so I think it's just easier to kind of let the parents know, kind of be an advocate, because sometimes as clinicians, we're kind of just almost immune to a lot of the sad things that happen at Kaiser. I've been with my department for 15 years, so not that death doesn't make me sad, it's just part of the job, you know? So I think that's one of the biggest barriers is informing patients in general and giving them information on how these teams work and the benefit for them. Instead of just telling them you need to see an endocrinologist, you need to see a dietitian, you need to see a social worker or or a therapist, and explain to them the reasoning why, as opposed to just telling them, because that's the biggest thing in my work case.
Yeah, that brings the person back to the care, right? Because you're using the open communication, keeping the parents in the loop, making it so that they understand. Because I know
Right,
me as a parent, I would feel pretty lost.
right, and they
And
do.
if someone just handed me a pamphlet and said, "Oh, here you go, you're gonna see these 5 doctors," I would feel overwhelmed also. So I
Right,
like that. That's a good point.
And a benefit for me is the expedited referral process, where you can get a referral to go to another specialist in an instant. You don't have to wait and get approvals and those types of things. But one of the challenges for me is the clarity in roles, ensuring that each team member understands their role and their responsibility. That can be difficult and potential lead to overlaps or gaps in care.
Agreed. So there's communication barriers also. Um, like, for example, two doctors can order the same tests or laboratory work. So that's one of the things that I am thinking of, the challenges with the multidisciplinary teams.
Right, and that's with confidentiality too. So if you have two doctors ordering similar things, are they checking the chart? You know, at Kaiser, we're very fortunate to have Epic, where everything is kind of mobile. Even if you go to Northern California, it may not be as easy to access, you know, if you're a Southern California member, but you can still access it to a certain degree, and they still have some kind of info on your care. Um, but that's where the healthcare records come into play and make sure they're done correctly.
And I actually
and
work in the lab, so I know that when two doctors order the same thing, fortunately, because our computers do talk together,
yeah,
it can actually cancel out duplicates so that the extra information, extra tests, extra money, isn't being wasted.
Well,
yeah, but
here's another
you're
thing
talking about.
about.
Oh,
I'm
sorry.
sorry.
Go ahead,
Go ahead.
Melise. Oh,
Another place where I had been. I noticed that there are some barriers and blocks in those therapeutic relationships. Are and like from the sleep team. If you're not in that specialty, you can't see what the sleep team has done to your patient. All they know is that you've been diagnosed. You don't have a clue as to what the wheres. So there are some disparities when it comes to the therapeutic relationship as it translates, even in the mental health space, because that information is not shared with your primary.
got it. Very good. Let's go to number 2 topic. Who wants to lead this one?
So I'll do it. The impact on the multidisciplinary and multidisciplinary team structure on confidentiality, what we were leading into policies and the therapeutic relationships. As I stated just a second ago, those two, the therapeutic relationship, the transparency, open communication, confidentiality, and policies can help maintain the trust to assure that the patients and their information are safe. And we go through rigorous um, annual requirements where we have to go through these tests, and they send us emails for malware and spyware and all kinds of things to ensure that we're not clicking on them. And if you click on them one too many times, they make you go to these classes. Because I've clicked on them a couple times earlier on in my days, but they are trying vigorously to ensure that there's guidelines in our confidentiality.
Anybody wants to add?
Yeah, I just want to say, like, pretty much I had almost exactly what Melise just said, so I'll just add a little bit more. I have just that I think because there's so many people that could be involved, so many different departments, maybe the client could end up feeling more vulnerable because they're kind of like an open book for the world, and it might make them feel like the care isn't as private, even though we keep it confidential and things like that, but they may not feel that it is, regardless of what we tell them, regardless of how we phrase it, they can still feel like, okay, everybody knows my business. That's all I really wanted to add.
Very good. Um, so while multidisciplinary team structures introduce complexities around confidentiality, they also offer opportunities to enhance care through integrated support. The key to maintaining strong therapeutic relationship lies in clear communication, informed consent, and collaborative practices that respect client autonomy and privacy. When confidentiality is managed ethically and transparently, it can actually strengthen trust and engagement within the therapeutic process. Do you
Okay.
have any other thing to say?
Not on that topic.
Okay, next topic. Who wants
Do you
to
want me to
take?
read this one? I can read
Yes.
it. Here. How do you imagine that you can navigate maintaining confidentiality and trust in the therapeutic relationship while also engaging in appropriate collaboration of care and care and client-centered advocacy? Sorry. I can start. I think the main point is only sharing what is necessary to share. I don't think everything has to be told to every provider, you know. If it's not their specialty, then maybe we leave that part out. But basically, that, and then just making sure that if there's any like changes to referrals or appointments or, you know, the scheduling or anything like that, that's approved by the client. I think, again, it's just keeping everybody in the loop, letting them know what's going on, what's happening to them, so that, you know, it makes it less scary, I feel.
I have
I
an
agree.
example. I have an
Go ahead, Paul.
experience with this. So one time I went to physical therapy for my knee problem and my back problem. And so the doctor didn't find anything. And so a number one diagnosis, he wrote anxiety. So, okay, if that's what he thought, that's what's wrong with me, then so be it. So after that, not too many days after that, I went to urgent care because I overdosed on mushroom, you know, the drink, the supplementary drink that I took. And so I was like this when I was talking, went to urgent care. They didn't believe me because the number one diagnosis that was on my last clinic visit was anxiety. So they thought that I was having anxiety attack. They they just they didn't care too much about me until they said, okay, so maybe you need to go to the hospital. Maybe you need to. It was an allergy that was happening to me. So because of that, uh, I was really hurt by how I was treated in the urgent care.
Flo, did you have insight to that prior to you leaving the office? Or was that after you left, you noticed that anxiety was your diagnosis?
It was on the discharge summary.
So you, okay.
So like while you're walking out.
And that's where I was going to go with the client-centered advocacy, where clients need to be involved. I am an advocate for myself. Anything I see or anything I don't feel is right, I say it, right? I went to a doctor a couple times for the same exact problem every single time. And because they looked into the system and weren't listening to me, they kept diagnosing me with the same thing. And I told them, I said, no, that's not it. And when I went back into the situation, I told the next physician, I said, don't look into the screen. You tell me what you think it is. You tell me on
Because
your
they
own.
are influenced by what they read.
Well, we don't. So I think we get to a point where we have to engage on a level where I'm the physician of this, right? You have a degree, you have a medical license, you work on people all day, but you don't work on me. And I know the difference when this is off, when this is off, when this body is off. I know it's not what you're saying it is because I understand me. But a lot of people don't have that involvement or the role of fostering a sense of control and participation in their medical situation.
very
But
true.
of course, but of course I do. Because I'm just not, it's part of my personality.
But I knew about it after, when I
Yeah.
was leaving the clinic, and I said, what? So I went back to my PCP and I asked him to refer me to another specialty. And so that's when I went to PT, and now I have exercises, and it helped me. It's not because of my anxiety. That's why I have this knee and back problem. So that's one of
I think
it's a lived experience.
I think this was a great discussion on the benefits, challenges, in utilizing the multidisciplinary um, teams in the community health center. I have had a lot of interaction with the community health system, and it's not an easy one to navigate. So I do understand, the benefits and challenges. And the thing that people don't really know about the community mental health space, a lot of those people are there because they volunteer to be there. And they have private practices, and they come into that space and volunteer their time.
Got it.
So you might be getting somebody from Beverly
Good
Hills,
to know.
and you don't even know that because they're in those situations, they are, you're getting a top rated doctor with these accolades that you don't even have a clue about. All you know is it's, community mental health.
Great. Great discussion. I think we're
Yes.
done.
Yes. Thank you so much.
Thank you.
Yeah.
So we have to leave, right?
Yep. We got to go to another, we got to sign on to the next meeting. Perfect.
She already left. She already left.
She's like,
She
Wait, I
speedy
think it's
goes
still
down.
recording. Wait, it's
She
still
said, look, she
recording.
said, Christine said 5, 6 o'clock.